So I hope y'all can hear me. So we're gonna start. And I'm gonna start sharing my screen if I can figure this out.
Shall we do introductions?
Yes. While I pull up the screen, how about you start your introduction?
All right. I'm going to point to Katie Cox, who still has her camera on. So I'm going to put you on this box, Katie. Could you tell me a little bit about who you are and what Equi is?
Yeah, absolutely. Well, my name is Katie Cox. I use she and they pronouns. I'm the executive director of the Equi Institute. And the Equi Institute is a queer and trans health access organization. We facilitate a community health program that happens out of a couple of different outreach locations, including a hygiene hub and the Q Center. And we have a team of community health workers that provide peer support, services and systems navigation, harm reduction, and general support for the LGBTQ, AI2S+, BIPOC, and disabled communities, particularly those who are unhoused or insecurely housed.
Thank you, Katie. And I'm Madeline Adams. I will be assisting Angelica in our presentation today. I am a community health worker for the Equi Institute, which to me means that I get to serve directly with members of our communities and help our folks enjoy their best health. And ruthlessly, but with a smile, eliminate any barriers to access to healthcare that I run into, including the biggest barrier of all sometimes is just not having the information. So that's what we're here for today. Angelica?
Yeah, so my name is Angelica. I use she, they pronouns. I am also one of the community health workers. I've been doing this for about 2 years now. It's gonna be 2 years this October. That's wild. I love what I do. I feel like I've been doing it all of my life. I think that comes with like being the oldest and being a girl in a Mexican household. I read a post today and it was like, it's like you're a manager of the family. And yeah, it resonated a lot. And I kind of just been bringing myself, my personality to the work that I do and just making people feel that they're human in the systems that we navigate. And yeah, so I guess we can start unless anyone else wants to introduce themselves.
I think that's good. We will be open to questions, but so that we can maintain the flow of our presentation. We'd ask you if you're able to put your questions in chat, which you can put in there when you think of them, and we will address them at the end. And also for those of you who happen to be on phone, we'll be happy to take voice questions at the end of our presentation. This is being recorded, so if you're, so hello out there. For those of you who are watching this after the fact, you're also welcome, though your questions won't be able to make it into this meeting. If you do have further questions, there'll be contact information towards the end of this presentation. You could reach out to Equi Institute. We'd be happy to assist, and we'll also be pointing to other information sources on the web. Angelica?
Yeah, so with that being said, also, we want you to take care of yourself. So whatever that means to you, make sure that you're listening to your body. That could mean like you prefer to keep your camera on or off. That is up to you. We just want to make sure that you are taking care of yourself while you're receiving the information that we do have for you. So. Other than that, we just want to let you know that all of the information that we have in this presentation and that we have gathered is from the research that we have done that is out there already. It's just a lot of information right now, so we just decided to compile it and present it to y'all in the format that we know.
Yeah, and any mistakes, if we make them, that's human. They're ours alone. Anything amazing that we say is probably because it's been said before by our community. We will look out for one another. And so we want to give appreciation to everyone that has come together these last few months since MPox came on the radar back in May to help keep each other and our community as healthy and safe as we can.
Yes. All right, should we start?
Let's do it.
Okay, so welcome all to the community information session regarding MPox. Like I mentioned, I'm Angelica Martinez, and I have Madeline Adams with me today. She's going to be helping me, and let's jump right in. Okay, take it away, Madeline.
All right, so first off, names. Names matter. I'm a trans woman, and one of the most important times of my life was when I got to announce to the world and get on my ID my true name. And so viruses, they don't have thoughts, they don't have feelings, but they do impact a lot of people. And so names matter. We have an unfortunate naming disaster with MPox that happened not today, but 84 years ago. Some well-intentioned, I'm assuming, medical researchers in the Netherlands had a research lab that used animals, including monkeys, to test their medical theories. And they noticed what they thought was a new disease spreading among the animals in their lab. And since they first noticed it on their monkeys, they decided to call it monkeypox and try to take credit for discovering a new disease. Now, this is a sort of pattern that has happened over the years. Actually, the disease is well known in other parts of the world, and particularly in Central and Western Africa, where the public health people there had been taking, and traditional doctors, etc., had been taking care of the people that got this disease when it would appear now and then. And they understood, and do to this day, understand that this form of, it's a skin disease that includes, big painful bumps typically, and so that's a pox. Has nothing to do with monkeys, other than monkeys and humans are related, and we both can get it. And kids in that part of Africa would occasionally pick up this skin disease from playing with wild or domesticated pets and adorable rodents. We still don't know exactly what, if there's more than one animal host. One of the things that we're doing now is taking really good care of all the humans who have this infection, so that we don't give it to animals and don't create new hosts that can keep reinfecting us. So that's where it's not really a monkeypox, but 84 years ago, that's the best that Europeans came up with. We're just going to use MPox. The technical abbreviation is HMPXV, which the H stands for human. It's in the same family, the orthopox family, as smallpox, which was one of the scariest and deadliest diseases that mankind ever dealt with, and successfully got a handle on it. There is no smallpox live in the world, but we are always on the lookout for related illnesses, and this one is much milder, but still it's important to address because it can definitely affect quality of life for somebody that has it. Next slide. And there's the, why is it called it? Just monkeypox, and what's the problem with that language? So I just mentioned that. If we were calling it giving it a proper name today, it would probably be orthovid 22 if it was a brand new disease from an orthopox virus caused disease discovered in 2022. But it's not new, so the World Health Organization will eventually get together and come up with a new official scientific name for this old disease. But in the meantime, we're going to take care of our community. Next.
All right, so let's talk about signs and symptoms. So with MPox, the main characteristic of what it is and what gives it its giveaway and indication that it is MPox is like the outbreak, like the rash, the lesions that people get. Uh, there are also other signs and symptoms that can be associated to MPox, which, as some of us know, are flu-like, kind of like COVID. So fever, chills, body aches. Now, the thing about MPox is that some people have all of the symptoms in different order, or they just have the rash. So some folks might experience first like flu-like symptoms, and then they'll have a rash. And that could be like 1 or 2 lesions around their body. It can be a handful, like spread out, or be just in one area. Or someone can have a rash or a lesion first and then get the other symptoms. Or there's also people that only get the rash and that's it. They don't get any other symptoms. So it does vary on the timeline of how symptoms develop, but there are symptoms that you need to watch out for. Like I mentioned, the rash in all cases, fever, chills, swollen lymph nodes, exhaustion, muscle pain, back pain, and headache. Now, for back pain, recently the CDC recognized that for MPox, it would be upper back pain compared to any other back pain. So it's very specific on the type of back pain. Now, take in mind this person to person as well. Now, how is it transmitted? The main form of transmission would be skin to skin contact, specifically someone that has a rash or sore, and then they come in contact with someone else, and that's how it mainly spreads. Now, it also can be spread through respiratory droplets, but it would have to be in an excessive amount. But there's also transmission through other bodily fluids. And the thing about this virus as well is that it can live on surfaces. So that could mean bedding, clothing, any other hard surfaces. So there's various forms of transmission of how this virus can get into our bodies. But like I mentioned, skin to skin contact with an open rash or sore lesion is the main form. There are certain activities that are considered more risky compared to others. But also take in mind that it also depends on where the virus is staying. So the most risky, according to this chart, would be having direct contact with the rash or scab, or having intimate prolonged contact with someone that has the virus or that has like a lesion open and they touch you. Also going down the list, the more risky would be kissing, cuddling, and dancing with people that aren't fully clothed. And this would be directly inside, mainly because there's just like a lot of touching around other people. And possible transmission would be sharing drinks, and that would be because of the bodily fluids, so saliva, and then beds and towels and other items would be because the virus lives on surfaces. And again, dancing in a crowded party, but people are fully clothed. Least likely would be dancing outside, coworker to coworker transmission, trying clothing at a store, touching a doorknob, traveling in an airport or an airplane, swimming pool, hot tub, body of water, public restrooms, or a grocery store, coffee shop. Now, take in mind that all of these situations or, activities could also put you at most risk depending on who you're having contact with and who you are being around with and how you're taking care of yourself. So take that in mind. Madeline, would you like to talk about stigmas?
I would, which is interesting because stigma means multiple things, but the way it's being used in this case is we're talking about the shaming of a group of people or of putting a characteristic on a group of people and putting them like those people are not acceptable to us. And that's why we have this. Now I'm going to geek out for a second on stigma, if that's okay. The stigma seems to be, it comes from the Latin. It comes from a nasty old practice of, I believe it was Roman governments that before there was the internet, if you wanted someone to be identified for life as having done something unacceptable to your society, you could brand them with a mark in a visible place, and then anyone looking at them could then join in on the lifelong shaming of that person. So that's originally what stigma was, and it means a mark. And it goes back to the feelings that come to any of us that had skin growing up, whether it was pimples, blemishes, marks, beauty marks. Children can be cruel and can single out people that look anything different. And there seems to be an ancient fear that can come through kids and adults when there's something they don't understand that involves the skin, that looks painful. This tendency to stigmatize others or to stigmatize oneself even can come up. So the answer to fear is information, and the answer to stigma is care. Everyone, every human being that will encounter this virus and suffer from it in any way has our fullest compassion. It could be you, it could be me, today or tomorrow. And this is a disease that's not specific to one group of people. In other parts of the world, this has been known as a disease of children. Women can get it just as easily as men. It just happens that the outbreak that we're dealing with right now, that in 2022, started in May at a party among men in a Spanish-speaking place. And so if you think of that as the center of this particular outbreak, it makes sense that the people who have first gotten it have been gay or bisexual or straight men who have sex with men, also some trans women, some sex workers, and people who are in families of any of these groups. But this is because of our social contact. It's because we touched one another. It's not because we did anything wrong. And that's the thing, if you start to feel that shame, whether you want to put it on someone else or apply it to yourself, please take a step back and say no. Anyone with skin can suffer from MPox, and anyone with skin can help to keep themselves and each other safe and healthy. One of the things that our society has a real challenge with, besides the stigma that gets applied to gay or bisexual or so forth, people that have desires different from others, and we saw this with AIDS. I grew up in Northern California near San Francisco in the 80s, and people were actually afraid to touch anyone they thought was gay or whose gender was different, because they didn't understand the illness that was going around, and they mistakenly thought it was just something that those people had. And so I can remember back then learning to hold hands, to be there. Now this one is a skin disease, MPox is. So we're going to ask if you're caring for, we'll talk about that in a little bit. You're not going to deprive someone of care or even touch if they have this infection, but there are protections that you would need to have in place while the infection is active. And MPox can be spread through sexual activity, because sexual activity usually involves, especially enjoyable sexual activity, enjoys prolonged skin-to-skin contact and being close to another person. And these are normal human needs. And it doesn't say anything about your gender or sexuality, which we celebrate all of them. If you find yourself with MPox. And it also can come from holding hands, hugging, kissing, just being human with another human. Angelica?
Okay. All right. So with that being said, and thank you, Madeline, let's talk about the risks. So this is just pretty much pulled out of the Oregon Health Authority and what they have put as people at higher at risk. But take in mind that anyone that has skin is at risk. We're human, we're touching each other, we're touching things, like able to kind of do more like face-to-face contact with each other. So that promotes, being more intimate with each other. But according to the Oregon Health Authority, people who live or have close contact with anyone who is most at risk with MPox is considered more at risk. If you have multiple partners or know your partner as well, if you are a laboratory worker performing MPox testing, or even a clinician performing these tests, or if you anticipate or have recent skin-to-skin contact with at least one other person, and I think that's a lot of us. And if you haven't had any previous smallpox, vaccination kind of puts you at a little bit higher risk, but there's no guarantee that it will give you full protection. But yeah, like I mentioned, with the stigmas that Madeline talked about, they have come out with this list, but as I mentioned, we all have skin, we like to touch each other. So let's take care of each other, like be more cautious. Now, just because MPox is kind of considered more of a mild disease, meaning that you're less likely to die from it, doesn't mean that you aren't able to. So there are certain groups of people that are more at risk for developing a serious illness. So those folks would be immunocompromised folks. So it could be that they are living with a certain immune compromising condition. They might be undergoing cancer treatment, have had an organ transplant, or taking certain medications that compromise their immune system, children, and people who are pregnant. So these group of people are more likely of developing a serious illness and or experiencing death. So just because it's a mild disease doesn't mean it's not severe for others or can be severe for others. Now, I put these links here. The CDC does a great job of updating at least 2 times a day their case count. And I think they updated like in the morning, like around 10, and then they updated again like around maybe 2. And since yesterday, I checked in the United States, I went up by 500. And in Oregon, I think they only reported 1 extra case. But also take in mind that because MPox is very ambiguous, meaning that it can look like a pimple, it can look like a bug bite, it can just look like a little blemish. Maybe you think you have a mole, like a new mole. A lot of people aren't going to the doctor or getting tested. So these numbers are probably lower than what we actually are seeing out in our community. So take that in mind. But like I mentioned, they are reporting these cases, but not to the extent that they should be. But thankfully, there are vaccines that are out there. Yes, I know, thankfully. So there are 2 right now. The one that I have seen in Oregon that's being provided is the CHWs vaccine. It also provides protection against smallpox, which is great, even though we haven't seen smallpox in a while. It is a 2-dose series. You receive the second dose 28 days after the first one. And then after your second one, 14 days after, you're considered fully vaccinated. It depends on certain people where it's administered. It can be in your forearm, it can be in the back of your arm. This is the vaccine that's recommended for people that are immunocompromised and or have eczema or other skin condition, since it is a lot safer for folks. I haven't seen the second vaccine, which is the CAM 2000 being provided here in Oregon. It is a single vaccine, but you're not considered vaccinated until 28 days after. And this one is not as recommended for certain people. Is probably the best for certain folks. Probably check in with your county if you're going to get vaccinated. Every county has different guidelines, and we'll talk about that soon. Now, vaccination is highly recommended for certain groups of people. Again, this is what's pulled out of the Oregon Health Authority. Pretty much anyone that's like a healthcare provider is encouraged to be vaccinated. So anyone that also as well has had direct or extended skin-to-skin contact with someone with MPox, if you have HIV, if you are taking any HIV or PrEP medications, if you have been diagnosed with gonorrhea, chlamydia, or syphilis within the past year, or had sex with an anonymous partner, attended a sex on-site venue, sex workers, if you work and or visit any dance, adult entertainment venues. But like I mentioned, anyone is at risk, specifically certain groups of people that are more highly at risk of being affected more.
We strongly encourage people, if they're eligible, to get the vaccine as soon as they're eligible. It's an easy vax to take, and they've done some quick research, and they found that even while you're waiting till you can have the second dose, it's providing some really good initial protection to reduce the chances of getting MPox, even after just the first dose. And that gets even stronger after the second dose that makes it complete. Angelica?
Yes, exactly. And the current eligibility requirement as of September 15th. So anyone that anticipates or is having direct contact or skin-to-skin contact specifically with at least another person, they encourage it. So that means a lot of us can get vaccinated now. And so if you know anyone in your social circles or communities that have MPox as well, you are able to get vaccinated. But that also varies from county to county as when you can come in to get vaccinated. So for right now, Washington and Multnomah County are working together, meaning that if you call the number provided, which is the Multnomah County Vaccine Call Center, they're able to, they ask you questions to see if you fit the eligibility. And they're, going off the honor system, they're just asking yes or no questions. They're not asking you to provide proof of any of the questions that you're answering. And then they'll just take your basic information, which would be your name, your phone number, your date of birth, and they'll look up around your area and see what's available. And so Clackamas County, you can schedule online. From what I saw right now, they're only offering at the Clackamas Town Center. And Multnomah County would also probably send you there. That's where I went to go get vaccinated. Took about 30 minutes to like the moment I walked in to the moment I walked out. Very chill, very calm. Doesn't hurt, honestly. And I think it's worth it. So that's for the Tri-County area. So if you don't live in the Tri-County area, I encourage you that you do some Googling. The best way that I found to get results on Google is searching like the name of the city, maybe the name of your county, and then monkeypox vaccine. That's the way that Google pops out more like results. Now, if you want to see like a map to see what's around you, I did find this website called mpoxvaxmap.org. And it's pretty cool. You put in your zip code and it'll show you in your area what's around. It'll give you like the name of the clinic and their phone number. And I highly encourage you call and see what their protocol is, what their guidelines are. Since certain locations will ask you, are you showing any symptoms? And they'll have you wait until your symptoms clear till you go in. Some counties like, well, okay, well, if you've been exposed, like let's get you in immediately and get you vaccinated. So it really varies. So check in with your county, see what their guidelines are, what their protocols are. But as of recently here in Portland, there are going to be 2 events this weekend. So Sanctuary of Friday and then Candies on Sunday. So Friday it's going to be 5 to 8, Sunday 5 to 9. Both of these locations they're in the same building. Candies on the bottom, Sanctuary's on top. And they're like around the corner from Powell's Bookstore. So it's pretty easy to find. Highly encourage it. And they're BIPOC and very mafia friendly. So ABC mafia friendly to the folks. Please check it out. We're also giving or providing COVID-19 boosters as well, vaccines. That's what you're interested as well.
Right.
Let's talk about if you exposed. So from the moment that you know you were exposed, we recommend 20 days after that you check in with yourself. That means maybe taking your temperature, paying attention to your body. Does anything hurt? Or do we see any new lesions, any like new blemishes on our body, rashes, sores? Now, if you do develop a rash or a sore, highly recommend you contact your doctor, your primary care physician, see what they recommend. If they do ask you to go in for testing, it's recommended that you cover all of your rashes or your sores with bandages or clothing. You're avoiding close contact with anyone, skin contact. That way if you are positive, we're preventing any other people from getting exposed. But according to the CDC, if you have been exposed to MPox, you can continue your daily routine as long as you don't have any signs or symptoms of MPox. But then again, contact your doctor if you do and see what they recommend and what they require you to do to come in if you can.
Yeah, and if you, yeah, and don't be intimidated when we say bandage. It can be as simple as, this is not a product placement, but a Band-Aid or other non-stick wound covering. You just want to make sure you're not putting anything adhesive on the sore itself.
Yes, make sure that if you are covering your bandages that you are comfortable as well, that they don't hurt. Make sure that you're not causing any more damage to them. But there is testing, thankfully, like I mentioned. But again, it is up to your provider to see if they recommend for you to get tested. The only way for your provider to test you is to swab like your sore if you have like a wound or a new blemish that you're concerned about. And then they'll send it to the lab and they'll let you know. But that's, like I mentioned, the only way to find out. I know some of us don't have access to a primary care because insurance, we're not established. If that's the case, that's okay. Multnomah County STD Clinic can offer testing. Give them a call, see if they can get you in. If that's not an option for you, as Equi, we do support folks on connecting them to other clinics. So we do have some resources as community health workers on how to find a clinic that's right for you and what might be a good option for you. So there are other resources for y'all. So hit us up right here. Okay, let's say that you went to the doctor and they said you're positive. Like, what do you do then? So your doctor will give you some guidelines that you have to follow. The most typical ones that we found is isolate, disinfect, communicate, and cleaning, redress any open wounds. And we're gonna be going each of these bullet points in separate slides coming up. Now, the most important part of your recovery is trying not to spread the virus. So that would mean isolating yourself. If you live with other people, then you're gonna have to isolate in a designated area. And so that means until all your rashes are fully healed or your lesions. So that could take up to 2 to 4 weeks, depends from person to person. Cover your lesions as much as you can. Recommendations of your doctor, how they recommend you cover yourself. That way you're not spreading the virus anywhere else. As mentioned earlier, that's the main form of transmission. So if it's more comfortable, wear long pants, long sleeves, cover them. If you do have them on your hands, wear gloves. Part of being isolated is also you're gonna have to isolate your pets as well. As mentioned earlier, MPox is a zoonotic disease, so it can be transmitted to animals as well. So if you are, like I mentioned, living with others, you're gonna also have to take care and disinfect of common spaces. So if you have to use a bathroom, you're gonna have to disinfect it before, after you use it. That way you're not spreading the transmission to your other housemates. as well as the kitchen, making sure that you're disinfecting what you touched after. With that being talking about disinfecting, you are going to have to disinfect the areas that you were in prior to finding out that you were positive. So let's say you were all over the kitchen, so you have to disinfect like the countertops, the tables, the light switches, anything that you could have possibly touched, as well as like your, your kitchen, your bathroom, any surfaces that you think you could have been in contact with. If possible, wash your clothing, any bedding that you probably are sharing with anyone. Soap and water is great. I think from COVID-19, we learned a lot about disinfecting. So pretty much the same protocols as disinfecting when, COVID-19 protocols came out. So soap and water, bleach if you have it, any other disinfectant that you are comfortable using. Now, communication is important. We got to keep our friends and family safe. So if you do find that you are positive, it's highly recommended that you notify those that you've been in close contact with. That way they can check in with their bodies, see how they're doing, make sure they're okay. That could be like, reaching out directly, send them a text if that's more comfortable for you, giving them a phone call, maybe just do like a Zoom call, a FaceTime, like, hey, I just tested positive. I hope that you're okay. Please let me know. Like, maybe give them some tips of like where to look for information. But also maybe you just had a casual encounter with someone and you don't really like know how to talk to them, or you don't feel comfortable talking to them about like these type of things. There is a website, thankfully, called tellyourpartner.org. It is a website geared towards supporting people, letting their partners know if they're exposed to an STD. That way that you don't have to tell them directly. But with this, there is a possibility that you are the last person that they have been with intimately, and they're going to know it's you if they receive this text message. So take that in mind. But if you do decide to go this route, they do offer your phone number, the person's phone number, and then know what STD or they've been exposed to. They have added MPox to the list, even though it's not an STD, but it is considered, it can be transmitted sexually, but also take in mind that's not the only way it can be transmitted. So once you get to this page, click and choose what STD you want them to know about that they have been exposed to. Once you fill out the form, they're gonna get a text that looks like this, and it tells them specifically like, this is where it's coming from. You've probably been exposed to these things. Please get tested. Here's a link of possible like clinics that you could find around your area. So that is another form that you could let other people know, but also take in mind, it is more geared towards STDs. Now, let's talk about wound care. I think a lot of us have seen the pictures online, and I didn't want to include the pictures in this presentation specifically because we're all different skin tones. The way our skin reacts to certain like blemishes or like pimples or lesions or sores is very different from each other. So that's why it's important to check in with yourself and consult with your doctor and see what they recommend for wound care. And the reason why I say this is because a lot of them are painful and itchy. So they might prescribe to you like maybe like hydrocortisone cream, but maybe you're allergic to that. Maybe there's an alternative. So please consult with your doctor, but also keep in mind, they will also ask you to keep them covered. And, also don't pick at them, don't bother them, let them heal. I know they'll be uncomfortable, but there are certain medications that your doctor can prescribe to ease the pain and the discomfort. So highly recommend, hopefully your doctor will give you some relief as well. As mentioned earlier as well and throughout, MPox can be transmitted to people or people to pets. So it really can bounce back and forth. So if you are positive, You have to isolate from your animal and from your pet. That doesn't mean you have to surrender them. That doesn't mean you have to abandon them or euthanize them just because they've been exposed. We still love them. They're still part of our family. That also doesn't mean that you get to like clean them with any disinfectant, like anything harsh, like they still need to be taken care of. But it's also important to keep an eye on them, monitor them. If you're positive, make sure that they're being taken care of and you're looking out for any symptoms such as like lethargy, lack of appetite, coughing, any eyes or nose like crustiness, bloating, fever, any pimple or like rash like. Call the vet, call their provider, let them know what's going on. And I'm pretty sure they're more equipped than we are to take care of them and ease their discomfort as well. So we love our pets. We need to take care of them as well. So, all right. Any questions? Anything you want to add, Madeline?
Oh, just how am I doing for sound? My internet connection was a little bit unstable there.
You're good.
Okay, let me know if that changes. One thing I would like to do before we go to the questions is, could you and I practice I know that when I'm a very emotional person myself, and it could be hard for me to bring up a subject that's a little bit cringe or a little bit awkward, and talking about health, especially this idea of exposing each other to infections, can make any of us sometimes feel awkward. Could you and I practice being two people who know each other, informing the other of this health information?
Yes, let's do that. Do you want to be the infected?
Yeah, why don't you start first, and then I'll practice second.
Okay, so the way I envision it is like, maybe we're having coffee and, we're chilling. And I'll be like, hey, Madeline, like, how have you been?
I've been okay.
Well, that's good to hear, but I haven't been so well. I hope we can talk about this. If you have space right now, we can. It also pertains to you, so this is important for you to know.
Okay.
So recently I noticed some changes in my body. So I decided to check myself out with my doctor. I don't know if you heard about monkeypox going around or even know what that is.
Yeah, I've heard of that on the news, but I didn't know it was around here.
Okay, well, yeah, it's not as common right now, but it's popping up again, out here, all over. But I do have to inform you that I did test positive. So as of last week, I think I had started having symptoms. So according to the information I have access, that you should be checking with yourself for, the next 21 days. And, meaning that if you see like any lesions, any sores, any like pimple like, on your body, it's probably best that you call your doctor and let them know and see how you can take care of yourself. I don't want to put you in a unknown situation. I just wanted to make sure that you can take care of yourself too.
Oh, thank you so much, Angelica, for telling me about that. I know it's kind of hard to talk about these things, but I really appreciate that you trust me enough to tell me about that. And I'm going to keep an eye out for it. Now, maybe you don't know this, but does this mean that I'm eligible for the vaccine now?
I believe so. So once you are have been exposed to, you would have to call your county and see what they recommend. Each county has a different like timeline if you have been exposed to when you can get vaccinated.
Okay. So then I just like saying this out loud. I'm going to pay attention to my body, keep an eye out, especially for rashes. And I think I'm gonna go do a little more research, and I think I'm going to go get vaccinated. But thank you for letting me know. And is there anything I can do for you? It's, you know, you're the one who's dealing with this. How is it feeling?
I think for now it's not too bad, but thanks for asking. I'll let you know if anything pops up.
Great. Yay, we did that.
Yeah.
Okay, now I'm going to try.
Okay.
And I never can predict how awkward I will be. So let's just drop in. Okay, Angelica, thank you for picking up the phone. I may sound a little stressed or awkward right now. I just want you to know that's not about you at all. I just get a little nervous when I talk about tricky things. So I'm just going to get right to it. I've got a suspected case of monkeypox. We'll be getting the test back soon from the doctor, but I wanted to let you know we're pretty sure that that's what it is. So I was exposed, and I've got some sores now. And because I may have touched you in a time, we may have had skin-to-skin contact, you and me, while I could have been able to transmit it. We don't know that for a fact, but just I want you to know that so that you can take care of yourself. And if you have any rashes or symptoms, you can get tested for that. And if you want, you can go get a vaccination, which even I'm going to do after I recover from this. Do you have any questions? Do you still like to talk to me?
I don't have any questions, but thank you for letting me know. I do appreciate you being honest with me and being upfront about what's going on.
Thank you. So see, there's no perfect way of doing it. We just talk about these things because we are in relationship with each other, and telling each other these things means that we care. So let's jump over to questions, and I'll read them, and then Angelica, you can answer them, or you can refer it back to me. First question is, do you know, is the Sanctuary event going to be doing the 2-shot vaccine, the Jynneos?
Specifically, that's the only vaccine that they have at the moment. So that it's the most likely for that to be available, specifically because it's more available for people that are immunocompromised and have other conditions as well.
Great. And I got a word from my director that she believes that at the Sanctuary and Candy events that we expect that for people who've had the first shot, the second shot will be available now. So that's good news. It means that in our community, at least, we've had a good rollout with the first shots, and we're ready to start on the second shots. So that's good news. Next question. Is there any delay period that someone would need to have between getting, say, a COVID booster and a monkeypox vaccine?
Yes, they can't be administered at the same time. I don't remember the top of my head. I think it's probably like a week or a week and a half of time period from getting, let's say, a COVID vaccine or like a booster, and then getting like your MPox, or let's say you got your MPox and then your COVID. So there is like a waiting period. That's why it's important when you do call the call center to make your appointment, which I recommend compared to doing it online. They have more information regarding like when you should get vaccinated, if you are planning to get the booster or if you already did. So answer your question.
Yes, and because the medical best advice develops rapidly. When you're at the clinic or when you're at the vaccine event, just answer the questions clearly, and they'll let you know what the current guidance is. And I'm going to ask, this wasn't in the questions, but I'm going to ask it. Angelica, what do I do if what would you recommend I do if I'm afraid about MPox?
If you're afraid of, getting MPox, definitely, take care of yourself, meaning that check yourself for your body, see any changes, check in with like if you have a fever, any body aches, make sure that you are sanitizing your hands. If you're touching anything, you're sanitizing your surfaces. Very similar to how we were handling, or some of us are still handling COVID. So taking those protocols to make sure that we are disinfecting. Since MPox is mostly transmitted through skin to skin contact, then maybe it might be a good idea to like limit your skin to skin contact with folks. Make sure that you're being in areas where you're giving yourself space from other people, making sure you're taking precautions to take care of yourself, whatever that may mean for you. Now, that doesn't mean that because we can transmit it to our animals and our animals can transmit it to us, that we get to be mean to our pets and be very paranoid, which is understandable, but also beings as well. And just checking in with yourself, contact your doctor if you have any concerns. Everyone's immune system is a little different on how we, process symptoms as well. And also,
thank you, Angelica.
Community health workers, and we're more than happy to talk to you and do some peer support and talk about your concerns and navigate like the situations that you're going through and figure it out with you. That's
right. Yeah, we understand that this is that anytime you're not feeling well, anytime there's an illness, your own or someone close to you, it can bring up a lot of feelings. And then one of the things that a community health worker can do is hold space, can talk with you about the health things that you want to talk about. We're happy to do that. And we will never stigmatize, shame, or treat you as anything less than the expert in your own life. We are in this together, this wild, wonderful human ride. There's one other question. Someone said that they're feeling nervous about making phone calls to getting vaxxed. Can Equi's community health workers help me make calls like to arrange a vaccine?
Absolutely. I think a lot of us enjoy making phone calls for people. It's a process, just we recommend that you hit us up, get to know you a little bit, see what the situation is and how you want to. We're more than happy to do that. It's not that easy. So that's kind of job, is to support y'all to feel comfortable to navigate the care that you need.
Wonderful. I think that's, let's see. I think that's it for the questions we've received. Could you give us, what should I do if I want to, if I'm looking for more information, or if I want to connect with Equi?
So definitely, we do have our website. We do have a link where you can just fill out like a little intake of like how you want us to connect with you, like what's going on. And we also have a description of like what we do more in depth. We also have a site that Katie has put together about MPox. It's very, I think, more geared to our community. So check that out. Send us an email that works for you. But also I have put the websites that I've been mostly like checking almost every day on like what's going on, since the CDC and the OHA are always changing their guidelines or putting in new information. Or if it's easier to contact us to get this information to be interpreted for you specifically, we can do that You just have to fill out the little intake that we have online, and we will get back to you.
Wonderful. So I think unless anyone had, someone said, thank you so much. Just want to second that. It is one of the privileges of my life is being a community health worker and working with a wonderful team who genuinely cares about people. Every time something becomes difficult in the world, it's an opportunity for us to exercise our capacity for love and compassion, grace, kindness, and mad skills. Just encourage everyone out there to be your own best community health worker. Look out for the health of yourself and the people that you care about. This is how we do it. We are a big village of people who care for one another.
Mhm.
And I'm excited that all of you attended today or online. It shows to me that you care both about your own health and about other people. And good on you. Let's keep this up.